Hello everyone, I'm Eddie, the EDTA K2 vacutainer with the purple cap. I'm one of the most important blood collection tubes in the laboratory.
Hello everyone, I'm Eddie, the EDA K2 vacutainer with the purple cap.
Hi Eddie, what makes you so special?
I contain K2 EDTA, an antigulant that prevents blood from clotting. I do this by binding calcium. This is essential for the clotting process. That's why we gently invert the tube 8 to 10 times immediately after collection. It mixes the blood properly with EDTA and prevents clot formation.
Exactly! But remember, don't shake. So, what tests are you used for? I'm the first choice for complete blood count, hemoglobin, hematocrit, platelet count, total and differential white blood cell count.
Hello everyone, let's learn collection. I'm nervous. Will it hurt? Will it hurt? Don't worry, I'll make it quick. First, confirm the patient's identity. Clean hands.
First, confirm the patient's identity using at least 2 identifiers, explain the procedure, and obtain consent. The healthcare worker washes hands and wears clean gloves.
I have everything ready. I'll help make the veins easier to see. Apply the tourniquet above the site.
Choose me! I am stable and easy to access.
I remove germs. Let me dry completely before the needle is inserted.
I enter the vein at about a 15 to 30 degree angle.
Fill the collection tubes in the correct order of draw.
Release the tourniquet before removing the needle.
Please apply firm pressure with the gauze. That was easier than I expected. I must be labeled immediately with the correct patient details. Now I am safe.
Placed used needles in me immediately. Never recap needles.
And that's the venipuncture procedure. Proper technique, patient
Safety and correct sample handling ensure accurate lab. Your blood sample doesn't go straight to the doctor. It goes on an amazing journey inside the laboratory.
First, your sample is received and carefully identified. The barcode is scanned to make sure every test belongs to the correct patient. Next, the sample is sorted and sent to the correct laboratory department. This depends on the tests requested.
Many blood samples are then centrifuged. This separates the blood into different layers, so each test can use the correct portion.
The sample is analyzed using advanced laboratory instruments that can measure hundreds of different substances with remarkable accuracy. Before your report is released, laboratory professionals carefully review the results. If something looks unusual, additional checks may be performed to ensure accuracy. Once verified, the results are securely sent to your doctor, helping them diagnose disease, monitor treatment, and make important medical decisions. Behind every blood test is a team of skilled laboratory professionals, working to provide accurate results for better patient care.
Here's an easy way to remember the order. Big labs run great labs good. B, blood culture. L, light blue. Remember the order, collect with confidence, and keep every result accurate.
Hello students! Today we'll learn some important laboratory tests used in urine analysis. First is the protein test. We detect proteins using the heat and acetic acid test or the sulfosalicylic acid test. Cloudiness indicates protein in urine.
To detect glucose, we perform Benedict's test. The color changes from blue to brick red. This depends on the amount of glucose present. Ketone bodies are detected by Rothera's test. A beautiful purple ring means ketones are present. For bile salts, we perform Hayes test. If sulfur powder sinks, bile salts are present.
Foucher's test detects bile pigments. A green color indicates a positive result.
Hidden blood in urine is detected by the benzidine test, producing a blue-green color.
Urine-specific gravity is measured using a urinometer. The normal range is 1.00 to 1.0025. This helps us assess kidney concentration. Let's revise together.
Preparing for your hematology exams? Let's learn the important stains. Let's learn them in just 1 minute.
Leishman stain is the routine stain used for examining to peripheral blood smears. Gemsa stain is the stain of choice for detecting malaria parasites.
These supravital stains are used to identify and count reticulocytes. Prussian blue demonstrates iron stores.
Myeloperoxidase and Sudan black B help identify myeloid leukemias. PAS stain demonstrates glycogen and is commonly positive in acute lymphoblastic leukemia. TRAP stain is classically used in the diagnosis of hairy cell leukemia.
Meet the platelets, the tiny heroes of your blood. Although they are the smallest blood cells, they play a life-saving role every day.
When you get a cut, your blood vessel is damaged and bleeding begins. Within seconds, platelets rush to the injury. They stick to one another, forming a plug. Platelets release chemicals that attract even more platelets. Clotting proteins then form fibrin threads. This stops the bleeding. Platelets help the damaged tissue heal.
Once the bleeding is controlled, platelets help the damaged tissue heal by releasing growth factors that support repair. Platelets may be tiny, but they are essential for preventing blood.
Hematological tests help evaluate blood cells, detect diseases. The complete blood count, or CBC, measures red blood cells, white blood cells, hemoglobin, hematocrit, and platelets, the foundation of hematology testing.
A peripheral blood smear examines the size, shape, and appearance of blood cells to identify abnormalities.
RBC count measures red blood cells. WBC count measures total white blood cells, while the differential leukocyte count identifies each type of white blood cell.
Platelet count evaluates the cells responsible for blood clotting and preventing excessive bleeding. Hemoglobin measures the oxygen-carrying protein,
while hematocrit measures the percentage of red blood cells.
ESR helps detect inflammation, while the reticulocyte count measures immature red blood cells produced by the bone marrow.
Coagulation tests evaluate how well blood clots and help diagnose bleeding and thrombotic disorders.
Bleeding time and clotting time are traditional tests. Specialized hematology tests include sickle cell screening, osmotic fragility testing, hemoglobin electrophoresis.
Together, these hematological tests provide essential information for diagnosing anemia, infections, clotting disorders, blood cancers, and many other diseases.
Why did your doctor order a CBC test? A complete blood count, or CBC, is one of the most common blood tests. It helps doctors assess your overall health and detect a wide range of medical conditions.
Your doctor may order a CBC for many reasons. It is used to investigate symptoms like fever. It also investigates fatigue or dizziness. A CBC can detect fixture.
Red blood cells transport oxygen. White blood cells fight infection. Hemoglobin binds to oxygen molecules. Indices help define anemia types.
Your results are looking good. There are no signs of infection or anemia. Here is a copy of your report. Fasting blood sugar versus HbA1c. Which one tells the real story? Let's start with fasting blood sugar, or FBS. This measures your blood sugar at one point in time. To make glucose sticks to hemoglobin. The calendar flips through weeks. It shows a 2 to 3 month average. This reveals your average blood sugar. FBS is your current blood sugar. HbA1c is average sugar over time. Both help manage diabetes.
Both tests are important. Together, they help diagnose and monitor diabetes.